Yeah, welcome everybody, and very delighted to be able to introduce Professor Nick Maynard, who is a consultant surgeon in Oxford, who's been travelling out to Gaza for 15 years to teach and provide humanitarian aid. He was actually meant to be out in Gaza 3 weeks ago and again this week. He's been in touch with Gazan medics at Al-Shifa Hospital daily since October 7th. So can I hand over to Professor Maynard? Thank you.
So thank you very much for asking me. I've been asked to give a brief presentation about what I and my colleagues do in Gaza. And I'm going to I've been asked to keep it to about sort of 10-15 minutes. So I'll try and be fairly quick. A little bit about what we're doing in the last few weeks. And then obviously it'd be great to have a chat about it all afterwards. So I'm a surgeon in Oxford. I've been a consultant surgeon in Oxford for 27 years nearly now. And I first went to the West Bank in Palestine back in 2006, I think. But I've been going to Gaza for the last 14-15 years. And I take a team of consultant colleagues of mine from Oxford for teaching medical students, but also in latter years, I've gone out with medical aid for Palestinians to carry out and teach cancer surgery, which is my main specialty out there. And I was meant to be there. I was meant to go in on October the 21st. We had a whole week of operating lined up, and that was cancelled. And I was meant to be there last week for teaching as well. So I apologize if everyone knows the geography, but just to remind everyone how small Gaza is. It's 25 miles long. There was a marathon there that last ran, I think, in 2007. But it's got a population of nearly 2.5 million people. So it's the most densely populated country in the world, which, of course, is part of the problem at the moment because all the bombing from the Israeli Defense Force has caused mass casualties. We go in through Erez at the top of the country there. That's closed, and the corridor that's intermittently open at the moment is the border with Egypt at the Rafah crossing. So one of the crucial to the World Health Organization definition of health is human security, and of course that is the one thing which has been most endangered in both the West Bank and Gaza for many years. And I'm going to talk briefly about the determinants of poor health, and dividing that into social, medical, and of course violent conflict. Social, this applies to the West Bank and of course to Gaza. Certainly the borders in Gaza are closed, and the economy is largely and variably disabled by the Israeli government. It is an occupation under military control with extreme poverty and unemployment, continuous food insecurity, poor water availability and quality, poor sanitation, a complete inability to travel, and frequent power cuts and energy and fuel insecurity, which of course has become particularly acute in the last few weeks, and now there is no fuel left for the hospitals. Obviously, many medical problems, a chronic shortage of drugs, medicines, disposables. As I said, I've been going out there for nearly 15 years, and even in so-called quiet times, there are always shortages of medical supplies. Malnutrition, some wonderfully talented doctors and nurses, some of whom are often unpaid for up to 6 months, 9 months at a time, but carry on working. Often outdated medical equipment. For the West Bank, of course, border and checkpoint delays for patients, a real difficulty in medical and surgical specialists getting in and out. And until they had medical schools in the last decade or two, often very poorly trained senior doctors who'd trained elsewhere. And of course, violent conflict. Now, this slide is something I've based on a talk I've given at various times in the last few years and predates what's been happening in the last few weeks. So this just gives an idea of what's been going on for decades. But of course, what we're seeing now is infinitely worse. Certainly in the West Bank, constant violent harassment by the Israeli Defense Force and of course by the settlers. And that's really bad at the moment. We're hearing all about Gaza, but of course there are terrible problems going on in the West Bank. Large numbers of permanently disabled youths in Gaza. Many young Gazan teenagers have been deliberately shot by snipers, and they deliberately target their legs, their knees, so they don't kill them, but they make them permanently disabled. Beyond any doubt, exposure to novel weapons, both chemicals and toxic metals, destruction of homes, killing of fishermen off Gaza, killing of farmers in Gaza by sniper fire, and of course, multiple Israeli Air Force bombing raids. And again, this is a slide I've shown in many of my talks to illustrate how bad things can be. And I thought I'd keep it up just to demonstrate how much worse things are now. This was Operation Protective Edge in 2014. I entered Gaza a few weeks after that finished. And this picture was one of the first things I saw. Now, of course, you'll all be familiar with these pictures because we're seeing them every day in the news at the moment. And this was one of the worst attacks by the Israeli Defense Force in recent years. But of course, the numbers that are killed in this conflict have been dwarfed by what's been going on in the last few weeks. 2,000 Palestinians killed, many of them women and children and elderly, and again the amount injured. But of course, this is nothing compared to what we're seeing now. And just in that conflict, I'd like to draw attention to the point at the bottom. There were 370,000 children who were recognized as need of psychosocial first aid. And one of the charities I'm closely affiliated with, the International Medical Education Trust, which I'm chairman of trustees, raises a lot of money for Gaza. And one of the projects we fund, the major project we fund in Gaza, is the Adam Center, which is a wonderful center run by child psychologists, providing psychological support to the many thousands of children who have had undergone severe psychological trauma during the multiple bombing raids. That center's now been destroyed, and it'll need to be rebuilt. Now, we've devoted many years to teaching Palestinian medical students. There are many medical schools, probably too many medical schools, if you ask me, in Palestine. But the medical students are, beyond any doubt, extremely bright, every bit as bright as the students we see in Oxford. But there are, of course, many, many barriers to teaching these students. Historically, a lot of didactic lectures and minimal clinical teaching, although I'm pleased to say that's really improved in recent years, particularly in Gaza. These are some of the obstacles they face. Clearly in the West Bank, the wall, which greatly limits the travel of the medical students in the West Bank. You have to have a permit to get into Jerusalem to the medical school, and many of them can't get into the main teaching hospital in East Jerusalem, Al-Maqasad Hospital. They have to go through multiple checkpoints, and the bottom right-hand picture is what greets us as we go through Erez crossing into Gaza. And you can see a watchtower in the distance, which will be snipers in there with their guns trained on us when we go in there. So for years, we've devoted ourselves predominantly to bedside teaching. We spend every morning in the hospitals. We take out a group of surgeons, physicians, pediatricians, obstetricians. I think one of my great colleagues and friends, Omar Abdulmanan, has joined us today. He's one of the pediatricians who's been coming out with us. And we spend every morning in the hospitals teaching clinical skills to the medical students. And this is me teaching some clinical examination. This is one of my colleagues teaching students how to read an ECG, and we do lots of radiology teaching as well. In the afternoon, we run a whole host of clinical stations, which are to teach them clinical skills. This is a trauma station. This is one of the assistants in the university dressed up as a trauma victim, and this is me helping to teach management of trauma to the medical students. This is Andrew Wilkinson, who's a paediatrician in Oxford, retired now, teaching how to resuscitate babies. This is a neonatal resuscitation station. This is teaching basic surgical skills. On the right, knot tying. On the left, basic keyhole surgical skills to the medical students. And this is Debbie Harrington, one of my great friends and colleagues, who's an obstetrician in Oxford, and she's teaching obstetric emergencies. This is the cord prolapse in a model, and she's teaching students how to deal with the obstetric emergencies. We also have an evening where the medical students present their audits to us. auditing a whole variety of things, and that's a wonderfully entertaining evening, and demonstrating how clever and bright the medical students are there. And we meet some wonderfully human people. I'd just like to talk a bit about this. This is one of the things that's so special about Gaza. Any of you who've been there will recognize what a truly beautiful people there is that lives there. And those that have been out there have made many lifelong friends. In the top left-hand corner, that's Inas, who's a young doctor now. She got out of Gaza 8 years ago on a scholarship. She hasn't been back to Gaza since, hasn't seen her parents until last year, and she's really become a member of our family. That's her sitting in our front room with our dogs. This is her in the middle, just having had her first baby. Down in the bottom left-hand corner is Sarah El-Saka, who's a great friend of all the Oxford doctors who go out there. She was the first ever female to qualify as a surgeon in Gaza. We've been talking to her daily for the last 4 weeks. She's been working every single hour at Al-Shifa Hospital until 2 days ago, when she was forced to leave. And we've been in regular contact with her. In the right-hand side is just some of the beautiful people we've met out there. And we were meant to be going out last weekend and should have been out there now. I'll mention very briefly Oxpal Medlink, and Omar, who's joined us today, actually, when he was a medical student on one of my earliest trips, set this up with some colleagues, and it's run by medical students in Oxford, and is an online teaching for Palestinian medical students together with Oxford students, providing online teaching and very dynamic teaching. And it's a wonderful thing that Omar and his colleagues set up all those years ago. Now, in recent years, I've also been working with Medical Aid for Palestinians, and they are a truly wonderful UK-based charity, which funds UK doctors and nurses and other healthcare workers to go out to Gaza to do predominantly, but not exclusively, surgery. And I've been going out in recent years to help develop some of the upper GI surgical services out there, particularly cancer, particularly cancer of the stomach, and also complex keyhole surgery. And we've had several trips out there now to operate out there. I was last out there in May of this year doing cancer surgery. I was meant to be going out 4 weeks ago. We had a whole week of operating lined up and it was cancelled. We've set up multidisciplinary meetings with them online, so that in the future, and of course this will be massively set back by events of the last few weeks, but the idea is that we'll have monthly MDT meetings where we in Oxford meet with them in Gaza and discuss all the patient cancers, with a view to advising how to treat and with a view to operating on them when we go out there. And we are in the process, or very early on, trying to develop a memorandum of understanding between MAP and Oxford University Hospitals to get a much stronger relationship between Oxford and MAP, so that we can take a much bigger team out there to help in all the different specialties. So I was out there in May of this year, and this is just a few photographs I thought I'd show to illustrate what we do. In the top left-hand corner, that's me out with a colleague, Bijen, who is a London-based surgeon who actually has been going out with MAP for quite a few years with me. This is the two of us with some Gazan surgeons with whom we were operating back in May. This is us looking at CT scans of the patient I'm about to operate on there in the middle. And this is me. In the bottom right-hand corner was Sarah, who's the young lady I showed you earlier, who's the first Gazan female ever to qualify as a surgeon, and a truly, truly inspirational person. And then, of course, we had 3 days out there, and of course this happened at 3 o'clock in the morning. We were woken up by a huge bombing raid by the Israeli Defense Force, and we had 4 days of incessant bombing. The country was locked down, the hospitals were locked down and kept open only for trauma, so we weren't allowed to do any of the cancer operations we had set up. We were confined to our hotel watching the rockets going from Gaza, the Israeli Defense Force bombing Gaza, until we were eventually evacuated by the UN late on the Saturday night. And then it comes to October the 7th, and People say it started then. Of course, it didn't start on October the 7th. That was the day when there was an appalling atrocity committed by Hamas terrorists, killing 1,400 Israelis. But since then, of course, there have been 10,000 Gazans killed, more than 4,000 children killed, although that's probably an underestimate because another 2,000 are missing, presumed buried under the rubble there. More than 200 healthcare workers have been killed. Multiple hospitals have been bombed. Only one hospital is now left taking admissions, and that's Al Ali Hospital, which, of course, you'll remember was bombed 3 weeks ago. Al Shifa Hospital, which is the one we spent most of our time in, is almost completely disabled now. And despite what you hear from some of the propaganda coming out of Israel and Western media, minimal aid is going in, nothing like enough, and certainly virtually nothing getting to where it's needed. So what are we doing? By we, I mean the many wonderful doctors and nurses that we have got to know, a lot of us in Oxford, but also around the country now. Omar, who's with us today, and two of his younger colleagues have set up Gaza Medic Voices, which the picture of which is on the right is a really fantastic social media platform, which had been set up for the Gazan healthcare workers to allow their voices to be heard. And I would urge you to go onto Gaza Medic Voices on Instagram. It's now got over 60,000 followers, and it allows people to post what's actually happening there. They're all verified. They all come from people we know or have been verified by people we know. There have been multiple media interviews by many of us to try to raise awareness of what's going on. Omar organised, and a few of us went down and held a vigil outside Downing Street last Friday for the killed Gazan healthcare workers, and the name of every single healthcare worker was read out to the audience. Jeremy Corbyn, I invited 100 MPs. Jeremy Corbyn was the only one that came, but a few other people, a lot of other, we had about 1,000 people there. In the last few days, the group has set up a global platform of global medics for Palestine to pay attention to what's happening in the West Bank as well. We're part of a global Gaza surgery response to try and set up telemedicine out there and to provide surgeons to go out there when we're allowed to go out there. Omar and colleagues have organised multi-city vigils for the killed Gazan healthcare workers this Friday on November the 7th and 17th, I think, in 10 or 15 different cities around the country. And we have managed to secure a session tomorrow morning, lobbying MPs in Parliament before the vote tomorrow afternoon. I'm going to stop there because you'll be very familiar with what's going on in the last few weeks, and I think I'd be delighted to take questions and have further discussions about it. I will stop sharing, and thank you very much for listening to me.